we would hope that we could get nurses on board to kind of give this app, get people to download it as they're giving them the discharge instructions to leave. And so you would maybe begin your account in the ER, like before you leave the hospital, but maybe at home. And this is the first screen that you would see after you downloaded the app. So what do you think you would click on this first screen?
Begin your account.
Cool.
Right?
Mm-hmm.
Now, are you going to have this ahead of time for people to do this while they're just sitting there waiting? Like, make a little, have you seen the boards in our room that have different things on them, like, you know, have your nurse introduce themselves, tell them to wash their hands, that kind of stuff? Have you thought about doing that so patients can do it ahead of time? Because when they want to get out of here, they want to get out of here.
Oh, I see.
So that way they could do it ahead of time. So
cool.
I'll make one. Oh, that's it. Okay. Submit.
Okay, cool.
Except, because nobody ever wrote
it doesn't say anything anyways.
When were you treated? Today. Submit. Where were you treated? In the Children's Hospital. Submit. Fever. Submit.
Okay, and we're going to pretend the rest of the screens we have are made for if you select skin wound.
Okay.
So, and just...
Well, I could have done that if you would have wanted. Skin wound. Submit.
Awesome.
So, leg, is that right?
Yeah, doesn't matter. We don't have
foot, submit.
Cool.
Okay. So this is today. In 2 days, check with your doctor.
And then I forgot to put like a next button on the screen, so that's why I don't know if you're looking for somewhere to click.
I was. What do I click?
So I don't. If there was like a button here that was like blue or something, just said next.
Okay.
So that's a little problem. It's kind of silly. And the same thing here.
Okay, the same thing.
Mm-hmm.
Yesterday we went to the doctor. Today we changed our bandage. We're all right, so we're not going to do anything.
And do these make sense? Like based on what this says, do you know what these do?
Well, I would think so.
Like, what is a photo timeline?
That means that's this, right? That you can see yesterday, today. Is that what that means?
Yeah, so if you took more than one photo, it would like just have just the photos instead of like all this text, so you could compare it, hopefully.
Okay.
Cool. Okay, so and then you would go to the next thing. And this is just the page.
So yesterday we went to the ER, changed our bandage. Today I feel... What if I feel okay?
Well, yeah, what do you think you click next from the home page? Or, like, where would you want to click from the home page? What looks like a button, I guess?
I want another button to go to the next page. Because there's nothing wrong. If there's nothing wrong.
Mm-hmm. So what sort of information do you hope is on the next page?
Today, you go to the doctor.
Mm-hmm.
Today you go to the doctor for a recheck.
Okay. And so, like, you think if you clicked, if there's like a next button here, that it would take you to something that told you that, or?
Yesterday, yes. Well, now this, this should be the day before yesterday, today.
Because I think, so this is kind of confusing, but we have, this timeline is set up as if you went to the ER, right, like yesterday, and so you've gone to the ER, you've had your wound and been taking care of it for like 48 hours maybe at this point, right? And so this is telling you still in 2 days you need to check with the doctor.
So today I feel you need to have a happy face or a sad face there.
And how do you think, like, what do you think you would hit to input that, if that makes sense?
A happy face or a sad face.
Okay.
Just something simple.
Okay. Does this make sense as a button? Like,
no.
Okay. So you
no, but I'm not technologically,
well,
so I don't know what all that stuff means.
Well, we want it to, you know, be used by everyone. So
yeah.
If it's not obvious to you, then it's not obvious to a lot of people.
Okay. So today I feel I'd put a happy face or a sad face, or maybe a couple, maybe like 3 or 4 choices at the most.
Okay.
Like somebody that's happy, or sad, and maybe somebody in between there.
Okay, cool. That's actually really helpful. That's exactly the sort of feedback that we want. And
so if that was there and I'm push happy face, I'm fine.
And can I show you what we have coming up? So now, if you hit that, the way we have it is that this screen will come up.
Okay, if I didn't push happy, if I pushed one of the other ones. Well, no, see, this has good and bad. I might separate this out to healthy, energized. And then on the other side, maybe you're nauseous, achy, feverish, worried. Although worried, I might tend to put that in a third column.
Okay. Because I think, would you want to select more than one of these things at one time or only one?
Oh, I think they would like to select at least a couple.
Okay, good.
Because that makes it more serious for them, if you know what I'm saying.
Do you think like patients tend to like overemphasize how? Is that what you mean by that?
Oh yeah.
Okay.
Very, very dramatic.
And then that's good to know. Where else? What would you push from this page then? Like what buttons?
Worried.
Okay. And then.
So now, just a question: when you're doing add a photo, are you gonna have different pictures of wounds?
So we're
or
gonna.
What does this mean?
So if you click that, is that the next one? No. But anyway, so if you click that, it'll let you take a photo on your phone.
Oh, okay.
And then you can take a photo of your wound, and you can store it. And so, like, oops, oh no.
Sorry.
This happened every time. Every time we come in here, I got like coffee or something on it. Right, so this is an example of that, right? So this person who filled it out, like, took a photo, and now it's stored on their timeline so that they can look back and see what their wound looked like a day ago. So that's what photo would do potentially. Cool. So, and then, so you added your photo, you picked which thing you felt, and then what do you hit?
Submit.
Cool. And, okay, so then if you hit submit, it'll take you back to this page, and your photo will be on here. Oh yeah, sorry.
So today's picture.
Well, yeah. So
that's a cool thing. Kathy, I didn't know you were here. Hello. I would have wore a dog shirt. Hey, I saw a dog shirt on Uniform Advantage. If you want to look at it, I almost ordered it, and I thought, no, I'll wait for you.
I saw a couple on another website too that I keep on getting through the email here.
I whined this morning bad because we were already short, and then people called in. And Sean came up and he said, "Di, are you working tonight?" And I said, "No, I'm calling in sick because I am sick of this." He said, "I'll get you help, Di." Hello. All right, sorry.
But I will tomorrow.
So, where else would you want to click on this page, on your home page?
What day am I today? Is today the day I go to the doctor?
We can say it's still an in-between day.
And is there anything wrong or not?
I don't know, let's say there is.
Say you're worried there's something wrong.
Is something wrong?
Okay, good selection. And now.
Is there a pager over here?
Oh, no.
Here we go.
Nice.
Do you think patients would know what all these mean?
Yeah, those are pretty simple terms. Those are nice terms. Puffiness. Submit. Alright, I took a picture.
Okay.
Call my doctor.
Yeah, does that make sense that if you hit health contacts, it would give you maybe your doctor's number or the hospital's number, do you think? Okay, so then we have a page for that where we have different numbers, but then if you take a photo, it'll go to this page. And so this is the photo that you took.
Okay. It looks like this. So then what do I do? Call my doctor.
Yeah, so I guess if you decide that this like looks
Like
like
there's
bad,
something wrong
yeah,
with
like
it.
something's wrong, then you click on health contacts, and then you can. Well, I don't know where that page went. We used to have a page that had numbers.
Okay. I gotta go
Somewhere
to
down
work.
there. Okay, but yeah, thank you so much.